San Francisco is suing the federal government. The city's goal is to save Laguna Honda Hospital and protect patients who have nowhere else to go. The Centers for Medicare and Medicaid Services decertified the 150-year-old skilled nursing facility. State inspectors declared it to be in a state of substandard care. Now on September 13th, the feds will stop paying for the care of hundreds of facility residents. KPIX 5's Andria Borba on the concern that closing the hospital and transferring people could prove to be too much for some vulnerable residents.
With requests for Medicare and Medicaid to come to the table ignored thus far, the city of San Francisco is using the nuclear option to keep Laguna Honda open in the form of not one but two lawsuits.
This is a matter of life or death. This is a last resort. We did not want to be here, but we are.
The first lawsuit from the city is an effort to at least delay the closure of Laguna Honda until after the city's appeals are finished.
We proposed a recertification process that would not require simultaneously kicking patients out of the hospital. It was rejected by CMS. We asked for 18 months to ensure patients would be safely transferred and discharged. Rejected. We asked to phase transfers so our most vulnerable patients would be transferred last. Rejected. The second lawsuit is a class action filed on behalf of patients and their families. Among the plaintiffs, Deborah Bauer. Her son suffered a traumatic brain injury and has been at Laguna Honda for 20 years.
My son feels safe there. I don't want that taken away from him. I don't want it taken away from him or any of the other residents that I see and we wave to in the hallways.
Medicare has already mandated some transfers of patients out of the facility. 9 people who have been transferred have subsequently died, and Medicare has paused the process. There is also struggle to find enough skilled nursing beds to transfer all 700 Laguna Honda patients into.
We understand that there are some patients that need to be transferred, and we are working on that. But we cannot turn them out into the streets. That is not an option. That is not caring for the patients. That is not putting them first.
The threat of closing Laguna Honda is personal to Mayor Breed. Her grandmother was a dementia patient there for 14 years before she died.
The nurses and the clinicians and all of the people who work there, they treat these patients like they're their family. When my grandmother passed away, her main nurse showed up to her service and a couple of other people who took care of her. They grieved like our family grieved.
Louise Renne, former city attorney who filed the patient and family class action, says it's unclear why both the state and feds are targeting the 700-bed skilled nursing facility. Medicare says the care at Laguna Honda is substandard and will no longer fund it. The agency says deficiencies included failing to train staff to dispose of illegal drugs and failing to investigate abuse allegations.
There are deficiencies in every single skilled nursing center and hospital in California because we're dealing with human beings. But you take a look at the deficiencies that CMS and the State Department of Health have pointed to, they pale in comparison to what we know, what our investigation shows, goes on in other nursing facilities. But yet CMS and the State Department of Health have chosen to throw the book at Laguna Honda. Why? Nobody's figured out why.
The lawsuits were filed on late Wednesday, and thus far there has been no response from Medicaid or the state of California. In San Francisco, Andria Borba, KPIX 5.
So the city's appeal won't be heard until at least October. According to the suit, Laguna Honda would need until November of next year to safely transfer its patients.